be the moderator of the conference today. Welcome to the regional Zoom conference on social reforms in South Caucasus countries, organized by Caucasus Civil Initiative Center from Georgia, in partnership with Public Association for Assistance to Free Economy from Azerbaijan and Association of Social Workers from Armenia. The goal of the conference is establishment of permanent and regional discussion platform on social policy issues, and it is organized for expert communities of South Caucasus, policymakers, and international organizations. South Caucasus countries are struggling with the apparent need to sustain economic and social stability while social and political movements to the governments are unpopular and reluctant moves are growing. But despite the chronic poverty and lack of public trust in the governance system, government social policies have undergone a series of reforms in South Caucasus countries, such as Georgia, Azerbaijan, and Armenia. Social policy reforms are necessary measures for sustaining economic and social stability. The conference working language is English, and it will be live broadcasting on Facebook page and the YouTube channel of CCIC. The conference will be opened by Angela Parulua, Director of Caucasus Civil Initiative Center, Georgia. Angela?
Thank you, Irma. Good morning. It is a pleasure to welcome you here in this regional conference on social reforms in South Caucasus countries. As Irma has mentioned, I am Angela Parulua, the Director of Caucasus Civil Initiative Center. I would like to thank to our conference attendees for expressing their interest on social policies. Also, my special thanks goes to the experts for conducting very interesting research within the framework of our project, Confidence Building for Social Policy Reforms in South Caucasus countries. The aim of this project is sharing their experience and working together on social reform policies in Georgia, Armenia, and Azerbaijan. During our project, we had 3 expert online discussions where our researchers shared their interesting findings, and now we would like to share to the broader communities is interesting findings. So I can't wait to hear the presentations. But before, I would like to send a special thanks to our donors, to the Black Sea Trust for Regional Conference, and also to the partner organizations, that is a Public Association for Assistance to Free Economy from Azerbaijan and Association of Social Workers from Armenia. Have a good luck and wish you a successful meeting. Thank you.
Thank you, Angela. The word is given to Alexandra Sabou, Doctor of Philosophy, Secretariat of Eastern Partnership Civil Society Forum.
Good morning. Thank you for giving me the floor, and also thank you for inviting me to this conference. My name is Alexandra Sabou, and I work as a Statutory Affairs Manager at the Eastern Partnership Civil Society Forum in Brussels. Of course, besides thanking for this invitation to our member, Mr. Zohtab Ismail, and to the Caucasus Civil Initiatives for initiating this project, I also want to thank the researchers, because I'm also a researcher myself, for their massive research exercise to conduct, to collect findings for this project. And I believe their findings could have never been more timely for policymakers in the capitals of the 3 South Caucasus countries, for civil society organizations, and for numerous activists advocating for social reforms and for EU and international stakeholders. Due to the nature of my day-to-day activity at the EAPCSF Secretariat, but also as someone who lived in the 3 countries of the South Caucasus due to my research, I lived in Georgia, in Azerbaijan, and a very bit in Armenia, I understand even more the implications of the pre-pandemic, let's say, limitations of the social sector and the need to change to suit more and more the social needs of the society. While before the COVID-19 pandemic, the need for social reform was more, let's say, a question of resources and also priorities, COVID-19 pandemic definitely showed us in a very accelerated manner over a few months all the failures of our social systems that have not been addressed for decades, or have been poorly or just partially addressed in our societies throughout the last years. And I think we as civil society have definitely a big role in leading this change, and also providing good policy recommendations to our national governments, but also to the EU stakeholders. And I'm definitely looking forward to listening to the presentations, and I'm happy to answer questions. EIPCSF has not been part of this project. We have been just invited to listen, and also we also received the policy papers, and we would like to thank you very much for that. And for those who do not know EIPCSF, it is an umbrella organization representing the civil society from the countries of the Eastern Partnership region. Within our structure, we have a working group which is dedicated to social dialogue and social reforms. And we are very much interested in the findings of this research. Thank you so much.
Thank you, Alexandra. It's very important for our conference that you find time to attend the conference and to give out the questions or your opinion of participants' questions. Thank you so much.
Thank you.
The next speaker is Zohrab Ismail, candidate of Doctorate of Philosophy, Public Association for Assistance to Free Economy.
Good morning, everyone. I also welcome all participants today. The project is really project focused on very interesting and also very sensitive topic in our region. If we analyze social situation in all South Caucasus countries, we see that we have approximately the same situation. Despite of the emerging from the former Soviet system 29 years before, we really all countries couldn't change social life fundamentally. And despite all South Caucasus countries are suffering lack of good social life, and also during this COVID-19 pandemic, we saw that we have a huge problem in education, social protection, and also in healthcare system. And because we all South Caucasus countries couldn't complete reforms on those fields. And so in this project, I coordinated, I leaded expert team, and we covered 3 topics in each country. And this is the social protection systems of South Caucasus countries, education system, and healthcare system. And also we partly tried to cover this crisis related to COVID-19 pandemic. I just want to inform you that we are preparing the publication of those research papers. It will be available in English, and approximately within 1-2 weeks, the publication in online and also printing version will be available for everyone. Thank you so much and good luck today in today's conference.
Thank you, Zohra. And now we start first session of the conference. And the topic of the session is why social reforms are important for the South Caucasus countries. Our first speaker is Tatevik Karapetyan, doctorate candidate of philosophy from Yerevan State University. Tatevik, we are all ready to listen to you.
Hello, everyone. First of all, I would like to thank you from the Armenian Association of Social Workers for the chance to be participant of this initiative. We value very much this kind of initiatives and are happy to take part in this. The question is very broad, and to answer it, why social reforms are important, taking into account the case of Armenia, we need to look at the question from different layers. And today I will look at it from two main dimensions. The first one is the social policies which are made, and the second one is the practice which we have in Armenia. Starting from this point, we need to take into account that we are speaking about countries who have the same historical preconditions, because all of us have the Soviet heritage, and we created our system based on that heritage. We take the state paternalism. During the Soviet time, we have the full package of state-funded primary services, including housing, employment, education, healthcare. We have the tradition to have institutionalized services for people with mental health, other disabilities, for abandoned children, and there was no professional approach to solving social problems. We have no social work, and we have mainly administrative approaches and monetary services for all these social problems. But the change, and after the post-Soviet period, when we go to the private economies, when it was all the economy was privatized, the crash of state paternalism and sharp economic decline bring for us a situation when the old rules were not possible to implement anymore with these new realities, new face of social problems. And together with this, we have sharp increase in social problems. We have higher rates of poverty, unemployment, homelessness. In case of Armenia, also child abandonment, because in the time of Soviet time, we have only 1,000 children in institutions. And after that, already in the end of 90s, we have already 12,000 children. And all these problems made us to rethink the old traditions and to see that with limited resources, what kind of system we had to have, which will be not only good system with good rules, but also will be compatible with the mentality, with the realities we have. So the need for balancing the new problems and traditional approaches came to us. What we have as a result was a reactive system of social protection, because there was no time to think strategically what policies we need to have. We have already the social problems arise, and we had to respond them. That is why after some time, we had to introduce very strict means testing principles in our social support system, because the resources, as I already mentioned, were very limited, but we have huge number of people who need this support. But at the same time, all the services which were forming and which we were providing to the population, they were mainly with administrative approaches which were coming from the Soviet time. Still, we had no, in the practice, professional social workers, professional social service servants. As a result, the social support approaches and services we have didn't bring the effectiveness that we want. Because if it is only a problem of economic instability, we can help the family with money. But if we have also the problems regarding the family conflicts, or I don't know, child abandonment, in this case, we need a full range of social services, more narrow specialized services. But we do not have these traditions, and a need to form this kind of services came. When we speak from the social policy perspective, we need to say that more strategic approaches in Armenia started from the 2000, when the strategic paper on poverty reduction was developed. But there also was not the political will to implement all this, because it was about changing the mentality, not only to having, I don't know, different policies or documents, but also all these changes were possible only in the case when the people who were working in the social protection system will be ready to implement this. But as we changed only policies, only laws and regulations, the forecast wasn't very good. In parallel, we have an interesting case when the social services were developed more in the NGO field than in the state field. If in the state field we have the superiority of administrative services, in the case of NGOs, we have more broad services available for the population. But at the same time, these services were not covering the whole country, and they were not very accessible for the population. At the same time, all the projects started to be not justified anymore, because when we are speaking about state paternalism and saying that the state is the father of the whole nation and will do everything for them, with limited resources, it is not possible. So the state needs also to make the population to be more socially responsible for their lives, for their social problems. And that is why, for now, the trend for the social policy is more on the activation projects, activation programs, employment support, and more to have more targeted services. Because for almost 20 years, we have a state benefit system, which was not non-conditional state benefit system with strict means testing, but at the same time, it didn't bring any change in the poverty rates. It didn't bring real impact on people who are living under the poverty line. So we have to change our approach to the problem solving, and the idea of introducing social work elements in the social protection system came. This was in the frame of so-called integrated social service system, which means that we will integrate all the available primary services under one umbrella and to give the population possibility to have accessibility to social services by one window. This was the first step toward this, and for now we are going in this direction, and maybe during this year we will have already this reform, which is being done starting from 2012 to implement it in whole manner. The second direction is the reorganization of institutions. As I mentioned, we had a very high rate of institutionalized children, but also people with disabilities. And for now, the main perspective is to have more community-based family type services for these groups, and to introduce at the same time social service standard, because if we are going to have a full package of services with full coverage, it means that we have also to have this licensure system for social services. And we are doing the first steps towards professionalization, because as a reactive social protection system was formed, as a result, a lot of people with no education came to the system and started to do the functions of social workers. For now, we have more than 2,000 so-called social workers in the system, but only 15% of them have a professional education. And this is one of the main points why we need the social reforms, because if we are not going to professionalize the services, we will not have the change in the quality of lives of our citizens. And in this case, another point is the need for practice standards, because when the developments and reforms are being done in subsystems, for example, like only in the child protection, and they don't have a full coverage, as a result, we have a system where a subsystem is more developed than another, which didn't bring real change in the lives of people. When we speak about the identified findings and the main challenges that we have, and which we can connect with the need to have these social reforms, it is important to mention that this is the point. For now, we are on the point where we need to have a more strategic approach, because the social problems change their face, and for now to give real solutions and to have a human rights-based approach, it means to go to all this in a strategic manner. And to have these social service standards, because we have the situation when how the service is being provided depends on the service, and the state has no real regulations in this field. Then another main direction will be the shift from the administrative functions to more professional social work functions. And the experience that we have for the last 20 years showed us that we will not be successful if we will have only intervention services or rehabilitation services without prevention and early intervention. And all the process we gone gives us lessons that we need to one more time to reflect our practice, our experience, and to build the system based on this. as a result of not strategical approaches in policy making, we have in some we have a very messy system. And maybe it is time to reflect and to understand what will be the main principles of the social protection system, how it will, what will be the distribution of the roles, not only among the social protection actors, what part of the responsibility on social protection is on citizens, and what portion of that is on the state. These are the main questions which we, for this point, need to answer. And if we are going to have more inclusive social protection system, if we are going to have more inclusive policies, it means that we need once more to understand how new forms of citizen participation in the policy making we need to introduce, how we need to balance the beliefs and values of the population with the policies that we implement. And if we are going to change the course of our social protection policy towards an activation projects, programs, how we are going to do this to have no crisis. Because all the reforms that we are implementing, they in some sense create risks. And we need to have this whole strategic approach to understand how to identify these risks and how to respond them in the whole this process.
Katevik, I'm sorry, please let me remind that you have 3 more minutes.
Yes, I already come to the end, maybe. And, we know that the social policies have great value in shaping social solidarity and boosting human development. But in this regard, we need to understand that we need an integrated social system reform. And only if we make steps as a country, as a state, and also as a professionals in this manner, it will bring real, not only social value, but also economic value for our societies. Thank you.
Thank you so much for this interesting presentation. I want to remind you that we will conclude first session, and after 3 presenters, you will have chance for giving questions and listening answers from the presenters. So please write down your questions and your comments, and then you will be given time to find out more about the topic from the presenters. Thank you. The next presenter is Azer Dilanchiev, from Doctorate of Philosophy from International Black Sea University, Georgia.
Thank you very much, first of all, for the organizers of this international, you can say, international and interesting conference. I think really that it is very important to bring together the experts and the academicians from the 3 South Caucasus countries, and especially from the academia. I would like to today to share with you the findings about the social reforms that the research that we conducted in Georgia relating to social protection system in Georgia. Before I would start, I would like to mention that the previous speaker, Statevik, already mentioned, and the historical process that our 3 countries of South Caucasus, Azerbaijan, Armenia, and Georgia passed through. I would like to just share the experience of Georgia, our findings and the challenges, so far that Georgia is facing. According to International Labor Organization, almost 5 billion of the population of the world today is unprotected. This is a real challenge. And if the social protection system is well designed, it can, from one side, decrease the poverty, while from another side, it can decrease the inequality. Coming to the reforms that have conducted in Georgia, it is almost similar that was in Armenia and in Azerbaijan, because we are sharing the same history. We came from the Soviet Union. Concerning in Georgia, things started to change after our integration with the European Union. Because in the process of integration to European Union, Georgia started to apply the norms of the European Union, and one of these requirement of the ENP, so-called action plan, is to make the reforms in the social protection system that is in accordance with the European social protection system. And of course, during the making these reforms, the methodologies were changed many times. And today, currently in Georgia, our population, is just divided into three layers in from the point of view how they are considering today our social protection system, because some part of the population, they are criticizing right now our social protection system, because they say that it is unjustly, our family should be there, but we are now out. While the others, they think that it's just unjustly we are just out from the system and we are not getting any kind of assistance. At the same time, there exists the third part, which claim that the social protection system actually it is totally discourages the population from the employment, or just giving the social assistance can discourage people to find the job, and they can just simply get accustomed getting accustomed for this process. Concerning on the financing the social protection system in Georgia, we saw that this year and in preceding year we achieved the maximum. It is almost 9.5% of our GDP, and it is historical maximum in case of the Georgia. We achieved this point. But if we will adjust it with inflation, because the prices are also rising in parallel to the increase in the social protection assistance, we can see that that money still is not enough, and it is not satisfactory. According to 2019 the data, it was 2.7 billion Georgian laris, which is, of course, in comparison with other years, it's good. And this year we even achieved 3.9 billion. And I can say that, especially in time of the COVID, it is vital to help the special social how to say weak population, also the population that really needs this this protection. What we also find is another interesting fact is that the population of Georgia is getting aged. So the aging is another problem, and each year this social protection have to increase. But taking into account that our resources are scarce and our finances are scarce, but especially after the COVID, which hit our budget, this sometimes after some period, this financing, we can have a problem of financing of the social protection system totally, because as I already mentioned, one of the problem is aging in Georgia, so people are getting older, and another problem is that the immigration process. And this is the real challenges that the Georgian government actually have to think about, because each year increasing the social protection. Yes, from one hand it is good, so you are protecting your population and special social protect people, but from another side, the increase in this finance in the future can we are facing this as a challenge for the Georgian government. I also would like to say a couple of things concerning on the pension reforms that have been conducted in Georgia. While we're making the research, one of our actual recommendations was to adjust the pensions for the inflation, because there was a fixed amount of the pensions while inflation was increasing and the goods and services, they are becoming really expensive, but pensions were fixed, and it was really a problem. And one of the recommendation was to adjust the pension with the inflation. So while inflation will increase, let's say 10%, pensions also will increase accordingly. So in this year, a couple of months ago, actually, Georgian Parliament already passed this law, and after that, in Georgia, our pensions will be adjusted with the inflation. And also a great step, I would like to say, that just started in the South Caucasus countries, among South Caucasus countries, just first started in Georgia, and we consider as a big step forward. It is the accumulated pension system. I would like to say just a little bit about the details. So from the workers, the employees, 2% from the salary is just deducted, and then 2% from the employers is deducted, and the government itself puts 2%, so in total 6%, and it is accumulated pension, which we consider that in the future will positively influence to the side of the social protection. What's interesting about social protection system in Georgia is the fact that it does not bring the people out from the poverty or the family out of the poverty. It just fixes the status quo. And this is the real challenge, because social protection system not only should support the family, but have to find the ways out how to bring out these families or the people in need out from this situation. That's why one of the recommendation is to make the changes in the system, because just fixing the status quo is not the solve all the problem. If we look to the parameters, how the social protection system changed the inequality in Georgia, we can see that it is, again, around the 0.38%, which is very low. So the gap between rich people and poor people still is the same, and the inequality problem still exists in case of the Georgia. So this was my small presentation about the findings. I would be happy to answer for your questions concerning our research and the findings. Thank you very much.
Thank you, Azar, for these interesting points regarding the social reforms in our countries and making parallels with Tatevic's presentation. We will be back with questions, of course, to you after the end of this session. So the next speaker is Hanan Aslanli, doctorate candidate of philosophy from Public Association for Assistance to Free Economy, Azerbaijan.
Thank you very much. First of all, I want to thank the organizers for inviting me to this project and to this final event of the project. It's my pleasure. Before going to the some conclusions and findings on of my research on the social policy reforms in Azerbaijan, I want to briefly explain my some views and approach about the importance of the social policy reforms or social reforms in entire region and in our country, in compliance with the name title of our panel. So it means, first of all, I want to a little bit emphasize my points about the principles of social reforms, why we think that these reforms are very crucial, special in this timing, and also what can be the guiding principles of this process. First of all, the social reforms in all country case, aim to correct social injustice and to improve the quality of life. It means if we still discuss the social reforms, it means we still have unemployment, we still have poverty, social inequality between the social groups and among the regions of the countries. And also it means we still have the serious problems in the human capital development. And also it means we still have problems related to informal economies and productivity, housing, and other issues. Of course, if social reforms will be conducted successfully, these reforms have a potential to transform the society. It has a potential for the societal and social transformation. But in order to have this transformation, the marginalized groups and vulnerable groups should be benefited equally and fair from all these social protection measures and the social reforms. Also, when we talk about the social reforms, we mostly concentrate on institutional capacity, legal framework, but also I want to underline that there are some additional factors that determine the success of these reforms. These are cultural norms, values, traditions, availability of material resources, financial resources, timing of these reforms, and of course the socio-economic situation or the cycle of the economy in that particular timing. Especially in the current time frame, we have a new additional drivers for these social reforms in our countries. First of all, this is a generational change that all our countries experienced it in the last 30 years. Now we have a new generation that demands high quality of life. They can raise their voice using all these social platforms, social media, and etc. And the governments have to respond all these demands, all these additional demands. Now we have a digitalization era, and also governments should adopt their reforms to this digitalization frameworks and the requirements. And also now we have another driver, that's a mobility of the population. So now people can easily travel around and to see some other cases, more successful cases, and to compare with their own country cases and to demand the more social reforms, social justice, and high quality of life. And also we have to be informed about, we have to be aware about some risks of these reforms. Because all reforms somehow create a resistance. Reforms trigger the group competition within the bureaucracies that should conduct these reforms, and also it moves some power dynamics, and also it creates some additional problems in the redistribution of the cost and benefits of these reforms. Some of the principles of the social reforms generally require to implement inclusive approach and multi-stakeholder approach. And the modern name of this approach is a network management. We know that currently classic public administration system and classic public governance systems also undergone the drastic change. What does it mean? If you look at the literature, we can see that the new approach, actually a new paradigm, is a network management paradigm. What does it mean? It's especially relevant for the social policy and the social reforms. It means, especially in social services, we have to look at all these policy areas as areas consisting of different stakeholders with deep interdependence, and they have to realize their activity in the form of network. And all this network approach, multi-stakeholder approach, inclusive governance approach requires us to engage to this process, not only governments and decision makers, and also business sector and the civil society. And another issue here is the timing of these reforms. We know that something has to trigger decision makers and policy makers to start reforms. It should be, or it can be either social demand, or it can be a crisis that can trigger all these issues. And also, another issue here is the availability of data when we talk about when we discuss the social reforms. Reliability of data, accessibility of data is very important, especially in these circumstances. Now I want to shift some conclusions and findings of my research about the social protection and social policy reforms in Azerbaijan. And also I want to use this bridge to start from the data issue, especially in the COVID-19 circumstances, in the circumstance of pandemic. Actually, government encountered the real scope of the unemployment and the real scope of the poverty. When we talk about the social reforms in Azerbaijan, we have to link these reforms with the availability of financial resources. In our case, oil gas revenues. We can see the clear link and clear correlation between the oil gas revenue inflow to the national economy and the implementation of the new social programs or changing of the social policies. For example, when we analyze the timing of this oil gas revenue inflow, we can see that the major portion of the oil gas revenue started to inflow to the national economy of Azerbaijan in 2004-2005, and government started to implement, for example, targeted social assistance program, especially in that year, in 2006. I have my own experience in the Ministry of Labor and Social Protection in 2006, when the ministry started to implement this targeted social assistance program for the low-income families. Actually, these programs continues today. The government extended the scope of these programs, and now around 350,000 people actually can receive this targeted social assistance from the government. But the average amount actually is always subject for the criticism of this. But coverage actually is more or less actually acceptable. It covers almost all regions. Another direction of the reforms was to convert social indicators. It means to somehow approximate minimum pension level to the average pension, minimum wage to the average wage. And also our government has already solved this indexation of the pensions. It means adjustment to the inflation some years ago. Another direction was organizational change. We observed different organizational change and reforms or reform attempts on the social protection systems. For example, we had the State Social Protection Fund. It was before the independent entity, and then the government merged that fund to the Ministry of Labor and Social Protection, etc. And also it created a new agencies. It merged existing agencies. A lot of this kind of organizational change, but actually I cannot evaluate the efficiency of this. But what we can easily observe, some easiness in the access to some social services and also receiving these social benefits. Legal framework also is not a major issue. The major issue here is the implementation. If we look at the legal framework, we can see that we have the concept of the pension reforms for the 2014 to 2020, we have the law on targeted social assistance, the pension law, the vision to future 2020 vision, where we had a lot of actually clause or a lot of commitments of the government on the social reforms. And also we have a strategic roadmaps till 2025, also where we have a lot of, which you can see a lot of commitments of the government related to social policy and the social reforms. But again, in the legal framework, we can see the almost a comprehensive existence of the different legal acts in the different aspects of the social policy, but implementation, of course, can somehow be criticized in some points. Another issue which actually raised a lot by the different researchers, I also touched that issue in my paper, that's the financial sustainability of social protection and the pension system. Again, despite these mandatory social insurance contributions from the individuals and companies, these contributions formulate only one portion of the budget for the state social protection foundation. Another portion of that budget, 1/3 portion of the budget of that social protection foundations directly comes from the state budget. And also around the 50% of the budget incomes directly comes from the state oil fund. So in our public finance system, when we also talk about the social expenditures, financial sustainability of the pensions and the social reforms, we can see this kind of inter-budget dependence. The pension budget of the budget of pension fund or social protection fund depends on the state budget's direct allocation of subsidies, and state budget's incomes depend on state oil fund. So again, there is kind of the fragility here or vulnerability here that somehow put at risk the financial sustainability of the social protection system. And also, maybe as one of the final points, I want again to raise the issue about the availability of quality of data on the social policy issues and not only pensions and the social expenditures, because it's a very crucial issue. When we look at the huge oil gas revenue incomes of the country, of the government, and also if we compare this amount with the improvement of the quality of life, we can see that somehow there is an inadequacy, there is a gap. So there are some improvements in the social system, in the quality of life, some incremental improvements, but it is not adequate to the huge oil gas revenues of the country. So it means we have to concentrate on the social budget, social expenditures, expenditures from the budget to the social protection measures, social programs, including self-employment programs, social benefits, and other programs. And also we have to concentrate on the education and health budget. So it means there is the problem here. And also, I personally analyze the reports of the Chamber of Account, which is the supreme audit institutions that conduct external oversight over the social expenditure budget. And also in the reports of this Chamber of Accounts, actually, I find some important conclusions and findings about some irregularities if these social expenditures somehow decrease the long-term influence or impact, positive impact of the social reforms and social programs. I propose it as one of the solution to involve the different stakeholders, especially in local level. It means the professional watchdog organizations and civil society organizations to conduct some additional audit of the social expenditures and the implementation of social programs in local level. The name of this approach is a social audit. It is an alternative to the professional financial audit that Suprema audit institutions, in our case, the Chamber of Accounts conducts. The social audit is conducted by the civil society organizations. It's kind of a bottom-up approach versus top-down approach that's implemented by the Suprema audit institutions. And also, when we look at the budget data on the social protection and social measures, social programs, we could see that some crucial data is missing, including some detailed information about the poverty, gender mainstreaming data, gender disaggregated data, and etc. So again, this timing in this pandemic period, COVID-19 period, which actually demonstrated and illustrated real situation in terms of poverty, unemployment, and the reliability problem of the official data. It's kind of also opportunity for the governments to also improve the accessibility and the reliability of data. Thank you very much for your attention.
Yohanan, thank you so much for this wonderful correlation between government and private social agencies' activities and system. It was very interesting to listen to your presentation. The first session of the conference about the social reforms importance for the South Caucasus countries is over, and the time is free and open for your questions and comments, and the speakers are all here and they will be answering your questions. Any questions?
So I would like to address to all of the experts that presented their findings. And first of all, thank you for this. I just wanted to ask you, we all know that the general picture of social policy in all of the countries is not satisfactory, but can you name any of the best practice that government has launched during the last 5 years, if there is any, of course?
If you want, I can start.
Okay.
Yeah, I would like to share the Georgian experience. One of the projects that was launched, and we can say that I hope that it will be successful because it is in accordance with the European Union standards. It is the pension system, accumulated pension system. You know that it's in Europe, it's widespread, and hopefully in the future it will cause to decrease the inequality in Georgia, and we hope that it will positively influence to the social protection, because this project got a very positive feedback from the European Union and from the other experts, and also from the countries who already passed this road. So from that side, I think that the pension reform that was conducted in Georgia, we can say that as one of the most successful reforms.
Thank you, Azar.
I can continue.
Okay.
If we will take the last 5 years, maybe one of the best things or the good things was the social contracting of services, because it helped to have a wide range of social services for domestic violence, for childcare, daycare services in the whole country. Maybe this is one of the good practices in Armenia, because for now we have this like services. We will not talk about the quality, but about the range and the coverage. In this case, it is the social contracting of services, which was very big during the last year, covering the whole country.
With your permission, I'll just add, just one stuff concerning Georgia about the positive experiment. It is the adjustment with inflation of the pensions in Georgia. In Georgia, pensions, it's one of the lowest in Europe, we can say like this, but the situation was even worse if we'll take the account that there was the inflation, and despite of the fact that there was, let's say, 5% increase in the pensions, but the inflation was eating, we can say like this, these pensions, and it is one of the good positive side that now it is adjusted with inflation. So which means that as a price will go up, automatically pensions also will go up. So it is, we can say that a positive sign. Thank you.
Thank you.
Thank
May I
you. I
continue?
think Kenan wanted to say a few words.
Thank you. So in addition to the existing programs that, as I mentioned before, the targeted social assistance program that started 15 years ago, so and some other new programs on self-employment, etc., etc. But I want to underline especially one actually institutional or organizational, maybe I cannot say innovation, it's a little bit ambitious, but the model, we can say, the organization model that the government started. Why underline this? Because last year, actually, I had a chance to visit that new agency and to observe from the inside how they designed that. So the name of this agency is the short acronym is a DOST agency in Azeri. If we can explain this acronym, it means Sustainable and Operative Social Provision Agency. It is a one-stop shop or one window system in the social services. Before actually, I personally observed that when the citizens have problems, legal problems, for example, there is about the payment to them on the social benefits and some other social payments, it was really challenging to go to this the local branch of the Ministry of Labor and Social Protection to get a right answer, etc., etc. But now there is a new agency, a very modern agency, and the citizens access to this the services about the registration for the receiving social benefits and etc. Actually somehow facilitated, accelerated, and they reformed. Of course, now it doesn't cover the entire country. It operates in Baku or maybe some few other regions. But again, the design of this agency, their service system, and actually is a real, actually touching moment that somehow improved the interaction between the citizens and the government block that regulated social protection system.
Thank you. If there are more questions, if not, then it's time to start the second part of the conference, and the topic is responses of the governments to COVID-19 in social reforms, which is,
Irma,
I think,
sorry,
yes?
I just want to interrupt you. Sorry. From social media, we have one question. Maybe I can ask it to our participants. So one is returning that what means can be used to make a political decisions after your recommendations? Maybe this is addressed to all of the presenters after their findings.
Could you repeat the question, please?
What means can be used to make a political decisions after your findings and kind of recommendations?
If you want, again, I can start.
Okay.
Yeah. Concerning on Georgia, our findings shows that each year the financing of the social protection system is growing, which is very good from the perspective of the ordinary people and from the perspective of so the people that need social protection. It is very good, and there is no question. However, from another side, We see that the financing of the system each year is growing and growing, and now it is 9.5% of the GDP, which is in the future can create some problems of the financing, taking also in the part that the population in Georgia is aging, which means that more and more money will need. From another side, the people are emigrating from Georgia. I mean, labor force is leaving, uh, also an employment problem. So, how the Georgian government in the future will finance this big amount? I mean, the demand for social protection will increase, and this is actually the challenge. And as a policy recommendation, the government actually have to take into account all these findings, and especially relating to the financing issues. One more time, I know that many times methodology in Georgia changed, but still we should, I think, go in line with the European best known methodologies, because in another way it can be really, really challenging. Okay, thank you.
Any more questions, Angela? More questions from the media?
Not from my side.
Okay. So then let's continue. And the first speaker for the second session of the conference will be Elchin Rashidov, public investment expert, economic forum from Azerbaijan. Elchin.
Yes, I'm just trying to connect.
Okay.
Okay.
You can repeat. Thank you.
Thank you. Okay, hello everyone. So I'm Elchin from Azerbaijan, and I'm going to talk about the public sector's response to COVID-19. So this is a recent phenomenon and a bit unexpected for the government. And so I'm going to talk about like education and health services, as well as social protection and the social protection. And the government of Azerbaijan has allocated 190 manats twice to unemployed people and people who also lost their jobs recently. And this is about a little bit more than $100. So, and the coverage and also the data seems a bit problematic. So based on people responses, some people who left their jobs, who are unprotected, couldn't get the money, and it did increase dissatisfaction among people, and the communication was not managed very well. So people did not know the criteria of selection. So it was not very easy for people to understand who gets and who doesn't. So oftentimes, so we witness like some people who may not need, and they get the money, but the others don't. In addition, COVID-19 caused the greater loss of jobs, and the government's reaction to pandemic, and also this caused a greater loss of jobs among people. And so this also increased the social issues among the people. So therefore, so what we can observe is a bit dissatisfaction among people and increased unemployment, and it seems also loss of jobs and loss of businesses. When it comes to education, so since April, the schools started the online education system. However, students are not equipped with internet, and they are not equipped with computers. Therefore, the access to education has decreased a lot. So now starting from this year again, the same situation continues. And so it's a bit responsibility of parents to find a way of how to connect to online education or just manage it at home. And we don't have a homeschooling system in Azerbaijan. However, the government started to recognize it. And there's no official status of homeschooling. However, now the schools let students study home and only participate in exams, And it has no status yet, but it has something like a bit social contract between schools and students and their parents and parents. So therefore, schools have also, the universities have also lowered their expectation in the exams. So the pass rate have increased dramatically, and literally everyone passes every exam, and the quality of education suffered both in tertiary education and secondary education. And there's only the private responses of parents on how to improve the education of their kids, but this is very fragmental, and this doesn't cover the entire population, on the little fraction of it. And when it comes to health system, and so we feel like the health infrastructure was overloaded, and it couldn't accommodate the patients during the outbreak of COVID-19. But the bigger problem was in information asymmetry, and people did not know how to react and whether to go to government, public, or even private infrastructure. And the situation has also worsened, not only with COVID-19, but also other diseases. The health infrastructure couldn't accommodate, and therefore the number of deaths in July 2020 has increased dramatically compared to earlier years, like 2018, 2019. And this is from other diseases, from the diseases other than COVID-19, And therefore, so there might be several causes to that. One of them is the quarantine regime that forces people to stay home and therefore exercise less, and also unemployment and this all the stress like accompanied with unemployment, but also the failure of infrastructure, the failure of health infrastructure. So basically what we see the lack of data when it comes to government responses and of what works and what doesn't work, and lack of communication and transparency, so people know what to do and how to do when it comes to education, when it comes to health, when it comes to COVID-19 itself, and when it comes to the assistance program, the cash the government, and also we see that also the failure of infrastructure, but failure of
Elchin, we lost you, but we can wait. Maybe you fix your system. Let's wait a few minutes. I think he will connect. He will reconnect. Before he reconnects, I would like to ask the. Oh, here he is. Okay, welcome back.
Okay. Thank you. Thank you. So basically, there's a failure of infrastructure when it comes to education and when it comes to health services. And in terms of education, this is the lack of internet, of people cannot, don't afford or don't have the internet connection for online education. And also like they don't, there's not enough computers available for people. And when it comes to health system, the infrastructure, I mean, is not, it cannot accommodate during the outbreak. But we also have the lack of communication and transparency. We also don't see the government making the evidence-based policy making. So there's no data collected and there's no evidence of what works and what doesn't work. But instead, like we also see the government invites the experts from outside, from other countries, including Cuba. But again, there's the lack of communication between the government and the other people, and we don't see like what they do and how they respond and what are the lessons learned. And also when it comes to social protection, the volume of social protection is much less the volume of jobs lost and during the COVID-19 outbreak, during the pandemic. And in addition, the government now tries with social distance and but the social distance in public transport is also a bit another issue. And I think maybe the government response should also include the increase in the traffic, so just to allow the greater distance among passengers. But we don't see it, and this is also another issue. This is also another issue. And also the government, I think, should recognize homeschooling, set standards, and just test students during with use standardized tests use standardized exams to test students. But we don't have it yet, and therefore there's a big now ambiguity, and now there's a big so people rather don't know how to educate themselves, how they educate kids, and so how to get the quality education. And the university response to that is that they simply lowered the expectations. They simply lowered the quality of exam, and nearly everyone easily can pass the university exams. Thank you.
Thank you so much, Elchin, for your interesting presentation. And because the topic is so active nowadays in the whole world, that we cannot help ourselves of giving you more questions. I have 3 questions, but I will give you them maybe first 2 ones at the same time. The first one is, you mentioned that students were not equipped with the computers and technology. My question is, if the teachers were well equipped, school teachers, if they were well equipped with the computers and the internet. And another question is, if to compare with the university condition, was it better regarding the students and teachers' equipment than the school condition, or it was the same?
When it comes to universities are even better equipped than the secondary education. And it's rather other way around. The universities are better equipped. But the universities have lowered the expectations. So it is not necessary for students to participate, or even if they do participate, the universities exams are very easy for them to pass. At least this is what happened during the spring semester. And this is also how the university started with fall semester. And when it comes to secondary education, of course, the access to internet and the computers, it is different in the capital city and in the regions, because also there's a big income discrepancy between Baku and regions, and that also reflects in the availability of computers and also the internet connection. And it also changes from school to school. So people know like some schools are better equipped and better prepared, and the others know like that some other schools will simply imitate the education. So basically, especially in the villages, there's a problem with electricity, there's a problem with internet connection, and the problem also many of computers with many teachers. So teachers, in order to keep their jobs, of course, they need to get some computers, but also they have never been trained. They have never been trained, and also they don't easily manage the online education. Online education requires, first of all, a special program to check the attendance, to check the participation, active participation, for grading, and etc. But in addition, the online education requires more effort from both sides. So because this is the learning process where the teachers and students are not basically in physical interaction, so they don't they communicate through online communication. That's very difficult and difficult to manage, and therefore what we see from past years and from the start of this year is that many schools simply imitate the education process, and the Ministry of Education still has no clue about how to improve the situation.
Thank you so much. Just to summarize, it means that university community members, lecturers and students, they have better skills of online communication, and it really helps them. Thank you so much. And my next question is, you mentioned that expert from Cuba was invited. My question is, why from Cuba? Do they have the similar system of education as Azerbaijan does, or why? And if it was beneficial for your country?
It's a team of experts and a team of doctors, like invited from Cuba. These are the doctors, not the education experts, like to help the government to combat the COVID-19, like this pandemics. And the Cuba, of course, has a better record of with dealing with pandemics, and also they have a better team of doctors. In Azerbaijan, we also have the Center of Reforms of in Public Health. Some of them are doctors, the others are public health experts. However, this center, the government public center of public health reforms, they don't work and they don't communicate well. They don't work well and they don't communicate well, and they even don't collect data. They don't have a database. Therefore, definitely Azerbaijan needs, the Azerbaijani government needs public health experts who can work with data.
Thank you so much. Thank you. I think Angela has a question.
Yes, one more question, please. So, how long it takes to fit the infrastructure to the current situation, and do you think that the government find this issue as a prioritized? What will be your comment with this regard?
Okay, let's start from the second one, the priority, whether the government finds it priority. And I don't say also that any feedback from the public, and it seems like both parties are satisfied, and the people don't complain much about the this worsening education and also the public health system, and but so it might be that infrastructure maybe that can be easily handled when it comes to internet and computers in the education, and but I think they need also change like rules of the game, like they did allow the homeschooling and like set standards on every subject and check simply and have the experts, team of experts of like for standardized exams and apply this standardized exam nationally everywhere, and that would solve the ongoing issue. And also the government is very for the government is very difficult because now they are also paying the people who work in the schools that don't function, and many people who work in the schools that don't function. So, and the government don't yet close the schools that don't function. Therefore, it's an issue of reallocation of funds and changing the rules of the game and reallocation of funds, and from schools that don't function to the other homeschooling standardized exam system that may function during COVID-19 outbreak. But that's also a challenge because indeed, I believe the future of education, the homeschooling is also one of the best practices, all practiced in many other countries for many years. And Azerbaijan, I think, should also allow homeschooling, and that would simply improve the access to education everywhere in Azerbaijan and may also improve even the quality of education. Thank you.
Thank you for your responses.
Thank you so much. Any questions?
I can have one question.
Okay.
So what is really interesting for me is how the measures which were taken during this COVID-19, how they were combined with the ongoing social protection measures.
Okay. I think there's no combination. There's no combination, and these are two distinct and apart systems. And of course, we had the social protection system, and this social protection system by the Minister of Social Protection and Labor, and they had a list of people who would receive cash, and also the pension system and others. And during COVID-19, increased the social problems because of unemployment, and when it comes to social protection, because of also disruption in education, because of failure of health infrastructure. So in three ways. And so these measures, so the government decided to give cash to people, and the criteria were not much transparent. And so simply some people received cash, but many people think like still the situation is much worse than compared to previous year, because the cash they receive twice, and each time a bit more than $100 is not enough to cover the expenses, and also the coverage is not enough to cover all people, all vulnerable people, all people who left their jobs, but some of them might not be that vulnerable, but the coverage was not big enough compared especially to neighboring countries and other countries. The coverage of people receiving cash here in Azerbaijan was not big enough. And they didn't get other forms assistances. They didn't get any other forms assistances. And I think they are not combined. Thank you.
Okay, thank you.
Thank you so much. If there are no more questions, then the next speaker is Ruben Markosyan, Doctor of Philosophy, Associate Professor, Chair of Public Administration from Erevan State University.
Dear friends, dear colleagues, I would like to greet everybody and thanks for these interesting discussions, presentations, and I had a presentation. I prepared a presentation, but it is another computer. I connected through another office. That is why I want to ask the administrator to allow me to share the screen. I can show some data from internet. I think it will be more visible. But before it will be provided, okay, it's already done. 1 second. Okay, I will do. As you know, the first steps to prevent the COVID-19 were undertaken in January when the global pandemic has started, and according to World Health Organization's recommendations, our government made first steps. It was mainly the preparation for this pandemic, and the first case was confirmed on February 29, which was followed by more strict regulations, transformations of overall healthcare system. And although the measures helped to postpone the spread of the virus, but step by step the situation became worse, and by the date when we presented the report, there were more than 8,000 cases in Armenia in end of May, and among which about 115 deaths. If now we will look to the situation now, let's remember, in May we have 800,000 cases, 8,000 cases, 8,000. Now we have 48,000 cases in today, and if in end of May we had 115 deaths, and now we have about 900 the spread of the virus, but step by step to share the screen. Look here, it is Worldometer info data. You see the number of active cases. The peak was in May when we presented the report. We even predicted the very big increase. And in July 7, July 10, we had the peak of cases. And from mid of July, data tendency was the number of active cases. The peak was in May when we presented the report. We even predicted the very big increase after the peak. And now, when the quarantine is announced, again we observe the increase of cases. And if we will look to the deaths figures per day, you can see that the deaths. 1 second. The daily deaths per day we have in July 16, 17, 18, even 20 daily deaths per day, the maximum. Now we have 3-4 deaths per day. Coming back to the phase, let's discuss the situation of and government prevention activities step by step. The first phase, which we call pre-epidemic phase, it was when till the 16th of March, the all activities. In 16th of March, government declared the state of emergency, which was 6 times prolonged till the mid of September. And it was a preparation state, this pre-epidemic phase when the emergency was declared, and government decided to close the borders with Iran, with Georgia, and after the first case, which was in February, as I said, we had also second case. There were no local transmissions. All main roads included. The first case was from Iran. The second and third case was from Italy and France. And overall, 17 cases were confirmed. And after that, the strict restriction phase started. This phase encompassed time from 16th of March till beginning of May. Based on act of emergency situation, only entrance of Armenian citizens was allowed to the country. The citizens' internal mobility restrictions were introduced, including close down of inter-community borders. It was a phase of mobilization when the human infrastructure and financial resources were activated to manage the situation. This included reprofiling also of 9 hospitals only to serve patients for COVID-19, and over 1,600 hospital beds were provided for this problem. And during this period, about 20 economic and social assistance programs were introduced by the government to help individual citizens and business to overcome social and economic obstacles caused by crisis. Now the number of these social and economic assistance program is about 30. It is some social assistance benefits provided to unemployed people. It was also social assistance to students, social assistance to the sectors of economy, to the companies which were seriously affected by the crisis, by this lockdown, especially the sector of tourism, hospitality, restaurants, hotels, received some financial support. For example, if the number of employees the company didn't cut, the government provided 20 or 30% of salary fund as to subsidize their expenses. There were also some agricultural support measures. There were also some promotion of IT companies' activities, and many other. About 25 economic and social assistance programs were introduced, and about 100 billion of Armenian drams, it means about $200 million, were directly injected into the economy. And also the banks didn't receive about 100 billion, another 100 billion of payments. The banks announced these credit holidays, so-called credit holidays, and about 100 billion drams, again, another 200 million US dollars were postponed or canceled by bank system. The third phase, it is grand lockdown exit phase, when starting from beginning of May, the restrictions regarding the economic activities and internal mobility of citizens in accordance mandatory security requirement and sections for not applying them were set. Mainly, this included mandatory use of face masks and gloves in public places, especially for public transport and closed areas. Now, and after that, even in streets, the mandatory walking in masks was obligatory. And the movement restrictions are being implemented in a localized manner for specific community cities when there was a big peak of this pandemic. At the same time, more strict restrictions and control mechanisms are being made for returning citizens, including their electronic registration, transportation to self-isolation sites, and control over keeping it. The government is expected to provide gradually the country out of lockdown amid indicators of all phased approach to keep infection rates under the control. However, after the May 20, the sharp increase in the number of cases of infections and deaths was observed. As you see, the peak was in in mid of June, and in these days our medical health protection system was really in very bad, difficult situation. Even we had days when people who confirmed that they need hospitalization, there were some delays of their hospitalization due to absence of places. And this very dangerous and very difficult situation was about 1 week. And after that, the government introduced a new hospitals to serve only for COVID issues. And step by step, the situation from medical service provision point of view was under the control. And the fourth phase, we can call it is not provided in our report, but in mid of September, the government introduced a new laws. You know, when this emergency situation was introduced, according to our constitution and laws, it should be prolonged each month. And that is why 6 times this emergency situation was prolonged. And government said that we have no other way to force the same mask issue and other restrictions if we will not have the emergency situation. If no emergency, there is no legislation base. That is why the government adopted and passed to parliament a new laws on quarantine. And when almost the same regulations as for emergency situation for this pandemic were introduced, and from mid of September, the emergency situation is cancelled, not prolonged for next term. And instead of that, government declared the quarantine situation, which is some way we are joking that it is a game of words, game of terms, but the situation is that from 15th of September, now the classes in schools, in universities are started. Now the children are divided in groups. For example, for schools, children are divided into 2 small subgroups, and the groups are periodically studied. One day, the first half of the class, and second day, the second half of the class are have to go to school, and the next day the children should study at home, prepare their homework, and go next day again to the school. There are also in universities the distance learning is introduced for graduate courses, and for first year students the classes are as usual without distance learning technologies. Generally speaking, we can say that now the situation is better, though after this big starting of classes in universities and schools, when the movement of population increased dramatically, transportation, also the restaurants and other places are open. Now we again observe the increase of cases. If I will again try to show you this 1 second. I can show you the graph indicates here that from September 13, 14, again, we have increase of number of active infected people. Before, the number of infected was decreased seriously, and it was very easy for the health system, and many hospitals again started their regular services. And if the situation will continue and the current tendencies will continue, I think that the government again will introduce will come back, and again some hospitals will serve only for COVID patients. This is the main tendencies. I'm sorry for not showing you the presentation which I have prepared with the graphs, with figures, with some comparisons and with other countries of the region. Unfortunately, Armenia is the leader of COVID negative figures. in our regions. We are the leader. At the same time, we can say that the health system has a very unique experience of this very tensive situation, and we hope that in autumn, in October, November, when it is normally the increase of infections will be observed, I think that our medical system will be more prepared for a second wave for pandemic. Thank you.
Thank you, Ruben, for your presentation. I have few questions, and the first one is how the prediction of active cases worked. Did it match with the reality nowadays, or?
Yeah, thank you. It is a very interesting question. Even in our publications, we using some predictions. We indicated, we also predicted that this increase, how it was done, the tendency indicates then, for example, if today we have such a number of increase, according to the experience of other countries, we can predict the same behavior of this curve. For example, if now we have, let's say in beginning of September, we have 100 cases per day. Now, for example, for yesterday, it was 375 cases. We see this increase. It means that in no way that for next week, we will have the increase of this curve if no any serious measures will be taken. If the serious measures will be taken today, we can observe its impact after 2 weeks. For example, if now we know that during last 6-7, yes, you can say.
And what are those serious actions?
Keeping distance, keeping social distance, wearing masks, and minimizing social interactions. If you will walk now in Yerevan streets in the evening, you can see a lot of cafes, young people having parties, spending free time, drinking coffee. All these are socializing interactions, and it will indicate that the increase of this disease spread will continue. The only way to this, as you said, the serious measures are masks, according to our experience. These are keeping masks, very often sanitizing hand with so-called alcohols. I always keep with me, this is a small balance. Everybody, I think, in Yerevan now has such behavior, and this is the only way. And minimizing interactions, not having big meetings, meetings and other events with a big number of participants. Unfortunately, the funeral and wedding ceremonies were the other very big channel of this disease spreading. And also even these police interventions, very strict interventions, often didn't help us to keep this discipline. We need to be more organized. We need to live with the coronavirus, but at the same time, we need to change our behavior. Indeed. And when a population observe a small improvement of situation, the people forget about this rules of behavior.
Yeah, as elsewhere else. Another question is, you mentioned social financial help to unemployed people. Can you please tell us in US dollars approximately how much it was per person? And for how many months?
Yeah, it was, for example, the people who were employed and became unemployed, they received a minimal salary, at least if about minimum salary, and some percent if their salary was bigger than minimum salary. It is about $120, for example, for 2 months. It was such such support for our minimum salary, about minimum salary rate to unemployed people. Also, you know, it was many critical points of view that many people were not registered, and now if they are not registered, how they can get this support. That is why government also introduced another tools. For example, if the family have 2-3 children and parents are not are unemployed, officially unemployed, in this case, the family receive about let's say $50 per children. There are also government, for example, paid about 20-30% of electricity and gas payment of previous months for all population, besides whose payments increased some threshold. So these types of social assistance, but you know, the government policy and strategy was to emphasize the promotion of economic activities and to help more employers rather than population. And the main support measures were provided through employers, through companies, through business, by strengthening new business initiatives.
Thank you so much. Next questions?
Okay. I have a question. Do you think that the distance learning will give us a proper results and is it effective generally? How do you think?
You know, as our universities and even schools never experience and practice this distance learning instruments, and universities and also our university, we have these tools introduced, piloted employers, various European Union and other business programs with our partner universities across this Eastern Partnership region. But the real testing of distance learning methodologies were not applied before coronavirus. That is why for lecturers, both for lecturers and students, it was really a problematic experience, and sometimes many experts say that it was a little bit imitation of education process. For example, I also was a lecturer. I'm a lecturer of Yerevan State University for master students, and I practiced Zoom. I prepared presentation and delivered the lectures, but I can say that it was a little bit problematic because both lecturers and students were not used with these technologies, and also for practical skills, for practical discussions, this format is limiting. Of course, it is better than to have no classes, but we can say that there were some difficulties, and the effectiveness of this education is still not so high. But I think that also, you know, each crisis is an chance, is an opportunity for improvement of situation, and I think. Of course, we had some decay of quality of education, but at the same time, we have a real-life testing of educational tools, education platforms, and sometimes the introduction of new technologies and innovation should be done by forcing the process. And I think the coronavirus was a very unique and very good from this point of view, very good case to promote for distance learning promotion. And from this point of view, I think we will have the increase of distance learning education quality for future.
Thank you for the detailed answer. And I'm wondering if you have considered the Estonian model of education, because as I have experienced 5 years ago, I have taken such very important courses by online learning, and it was like really good, resultful, and etc. They even have the e-voting, and this country manages it so well, and this country was really ready for this COVID pandemic. So do you think that in our region it will be, that the Estonian model will be taken?
you know,
Your opinion about this?
to deliver, it was an opinion that it is easier to deliver lectures and deliver this distance learning through these electronic platforms. But we can say that in order, the professors, the lecturers should design their courses, especially for distance learning platforms and distance learning methodology. It means many interactive cases during these 40 minutes, to show some videos, to have more visualization. If the lecturer is sitting in front of the camera like me now and speaking 30 minutes without having some pauses, it is pressing for lecturer, and at the same time it's boring for students. That is why these distance learning technologies should, it's not the same way of speaking. We need to show some visualized materials. We need to having these interactions among students, like voting, like having some separate group working and sharing the screens, etc. It means that the lecturers, professors should prepare themselves and should prepare entirely new course. The content will remain the same, but the course should be designed and prepared from the zero. And the lecturers were not prepared for this, and also they were not paid for this, and that is why all this. Of course, it is Estonian model can be applied, but it is more expensive rather than to use the traditional way of teaching. And it is not cheaper. It's not cheaper to have this distance learning methodology, platforms, combination of face-to-face and distance learning methodologies. It is more difficult and more expensive. And we need investments in this sector.
Thank you. Thank you.
Can I ask also a question and also have small comment?
Please.
Thank you, Ruben. I see we have also very similarities in the case of struggling with coronavirus, and also in the political approach. When you presented some steps of the government related to unemployment people, registration of unemployment people, and also providing of social assistance, they are actually very similar what happened in Azerbaijan. And the same problems and registration of unemployment people, and also providing fee. Apart from that, in Azerbaijan, the government used this COVID-19 issues for to reduce black market. For example, there was some restriction during quarantine, but if you are not officially working, you are allowed only 3 hours go outside, visit market, or for the pharmacy. Because of that, many shadow economy entities, they are forced to legalize their employees and to get the permission for employees to come to the work, because the quarantine was very severe in Azerbaijan. But also there was some abuse of COVID-19. For example, political opponents, and also some other issues to make COVID-19 issues to show more problematic, and on the other hand, to show people that this is the main problem, and so people should wait, and people should care about the other problems. How was this picture in Armenia? It is very interesting for us, how the government abused COVID-19 issues for its political interests.
So there are several points. I will try to address each one. Why? The first about the shadow economy. It's government started the fight against this shadow economy before this COVID pandemic, and the number of, for example, invoices, so-called checks, kasovых чеков, the number of these invoices provided in mass market, in shops, etc. In compare with, for example, 2017, in 2019, we have a huge increase of number of invoicings. For example, if I don't remember the figures now, but it's even 2 times much more invoicing cases per month than, for example, in previous in 2 years before. That is why, and also the incomes of state budget from this point of view increased. But that is why the COVID-19 was not the case for fighting against this shadow economy. But for example, when the government was criticized that why you provide the social assistance to registered and unemployed people, they say that, look, this is the best justification of our policy of anti-shadow economy, because if you pay taxes, if governments know that you were employed, now you are unemployed, you will give assistance. If you are not paying taxes, it means we have no information and we have no mechanism, we have no channels to provide the support to you. It was that COVID-19 was a case, and for the best justification that, look, if you will need support, you need to pay taxes before, and you need to provide this information. You need to be transparent. But about the criticizing the government policy, of course, also you have seen, yeah, we are now, if you will say the number of COVID cases, we are 16th in the world. If you will look the number of cases, number of deaths per 1 million population, we are 21st in the world. And if you will see the number of cases per 1 million per population number, we are 17 in the world. It is very high figures, and as you said, in compare with Georgia, the situation is not so good in Armenia, and such cases are best good chance for opposition to criticize government measures, and even the political opposition in parliament initiated to create a special investigation commission in parliament to investigate the anti-COVID-19 measures implemented by government. Government says that it's not the time. Let's see when the situation will finish, and we will compare the situation after the pandemic. But the opposition also said that we need to investigate now in order to correct the mistakes and not for future, and because about 1,000 people has died due to the coronavirus. But I think that if you will compare the number of deaths, annual deaths in total in country, and compare with previous years, my prediction that there will be a very, very minor changes in the whole figures from this point of view. For example, annual number of deaths in country is 28,000, and only these infections, diseases. We had about 1,000, 2,000 cases per year in previous years. I think that from this big statistic point of view, the situation will not so dramatic, and it is a little bit dramatized by opposition critics, and I think it's good. It will be a case for government to work better and to improve the policies, anti-COVID policies. Also, government, when introduced this emergency situation, it was the demonstrations, meetings, and other protests are prohibited. And sometimes opposition criticized government that you use COVID pandemic emergency situation to stop protests, to stop demonstrations. But from September, from the beginning of September, these limitations are cancelled. Now the opposition is free to make any demonstrations, meetings, but no so big activities are observed till now. So I think it was from this point of view, I, as a citizen of country, I don't feel that they used on purpose this limitation to limit political freedoms. I think the real motivation was to limit the negative impact of this COVID pandemic, rather than to use this emergency situation as a tool to stop the protests. Even I think that if you have the much number of protests, the less the tension. That is why I don't think that it is a real case to be anxious as a citizen. Probably I answered to all issues. If I forget about something, please remind me.
Thank you so much, Ruben. Are there any more questions from participants of the conference? I assume the topic is so interesting and active for all our countries that we would welcome you to jump in and share your opinions about this predictions for this against COVID-19 cases giving the increasing numbers to countries, and also what do you think is active out of those prevention activities and what is less important? It will be very interesting to hear your opinion.
I think, it is difficult. I think that we will have some increase of numbers for autumn. I predict that the educational institutions will go again to lockdown regime after 1 month or 1 month and a half. And I think that we need to survive this winter, this autumn, this winter, the season of these diseases, which regularly we have in this winter, autumn season. And I think that the situation will improve next year, both from economic point of view and also from social point of view. We will have about 4 or 5% of decay in economic growth, but the next year the situation will, I think, I hope, will be improved. Of course, to make predictions is not so good job. That is why, but I think that the situation will become worse, and we will forced to go into more restricted regime to survive this winter period.
Yeah, it sounded kind of interesting. You mentioned that meetings are not prohibited, they are allowed, but at the same time you have social distancing regime and limitations. So how can the meetings be? Our experience indicates that young people, the healthy people, they carry this virus even without any observed some sign of the illness.
Observed signs. I think, of course, that it is problematic, but the government is between two fires. From the one side, They are criticized that it is abuse of COVID situation. And also there are many other, after this, during these 2 years, a lot of political changes, political processes, a lot of political issues are now risen, and that is why there are cases when there can be some protests from different political organizations. So there are two fires. From other side, there is a lot of reforms, educational reform, changing of education curricula in schools, social reforms, gender issues, some religious issues, a lot of reforms, a lot of discussions. In society, there is a polarization, there is very hate speech atmosphere among current governing political forces and other political forces. That is why in this situation, when you prohibit meetings, it is a good case to be criticized as abuse. From the other side, if you allow protests, the number increases, though if young people will be more and active people will be more involved in these protests, there are not this risk group for this disease, but they have family members, and in some way this disease road will continue. And if the numbers of cases will continue, the government will be criticized. They are not able to manage the situation. It is like not lose-lose option, not win-win, lose-lose option. In any way, government will be criticized. And I think they need to find this medium solution in order to keep the processes. And if you have a lockdown, it is economic problems, it is a very big social impact, and also many people criticize and say that we need more government finances, more government subsidies, more government support to survive in this situation. And that is why government, the financial resources of government are limited. And that is why also they need to allow people to work, the restaurants to work, in order to not to pay social assistance money.
Thank you, Ruben. It was a wonderful summary from your side. Thank you. Any more questions?
Yes, if possible, I would like to ask the question, Mr. Ruben. Mr. Ruben, in Georgia, we have before the total, closed down. But I want a short reply. Just now, after government started to finance, support some families, like in Armenia, in Georgia also there was a support for families and for unemployees, also for electricity, gas, and other social expenses. But now we see that we have now the devaluation of our currency, and some of the experts link it with this support. And the government says that still we have to do such kind of supports. How is the situation in Armenia? What happens with the drama in comparison with the dollar? Is it stable or is there devaluation? Thank you.
Yeah, today's course is that against US dollar is 486 dirhams against $1, and I remember during the last 3-4 years the same number. Yeah, it is 480 till 480, but between, we can say it is, from this point of view, it's very stable, and no any even minor changes are observed. Of course, due to euro and US dollar variations, Armenian dram and euro, it can also be different, but dram USD is very strictly fixed. And from this point of view, we have no any changes.
Thank you very much.
Thank you. And the last but not the least presenter today, we have Alexander Rakwiashvili, who is Doctor of Philosophy from University of Georgia.
I'm sorry, I have to switch off and switch in after some minutes. Yeah, I'm sorry, okay. And thank you for questions. If I want, thank you.
Thank you so much. Thank you.
Hello, everyone. First of all, sorry that I wasn't able to participate in discussion because I have lectures and I have only 10 minutes now to present and to my research and discuss it. So my research was about healthcare system in Georgia. And the healthcare system in our country is very interesting because we implemented nearly all the possible healthcare models that it is possible to imagine. We have different models: centralized healthcare, healthcare financed by government or by citizens. And we had only short period of rapid development. It was late 2000s after wave of privatization, and after this privatization, Georgian healthcare is based on private property, and government was passive. And this industry had good perspectives, but as always, politicians have many incentives how to bribe voters and promise them free education, free healthcare, something free. And we also know that there's nothing free in our world. But anyway, when taxpayers finance someone's medical services, it influences incentives of people involved in this industry. So we got healthcare system after several reforms in 2013, which is technically free for big part of citizens, and which decreased the efficiency in healthcare. Now, Georgian healthcare, maybe it is quite developed industry in our country. Maybe it is better than in comparing with our neighbors. But in general, we had now worse healthcare system than it was, for example, several years ago. Major part of people here in Georgia think that it is good when healthcare is free and when it is financed by government. But in general, it changed incentives, as I told. And one of the biggest problems is that our hospitals are oriented on government and government budget. For them, source of profit is government. So the main idea is to satisfy preferences of bureaucracy. And they think they are they try to have a good relationship with bureaucracy, and they can ignore consumers' preferences, patients' preferences. So we have many situations when people get treatment which they don't need, when they stay in hospitals more than it is they need. And we have Georgia is the country with the most more doctors per capita than any country in OECD countries or in our region. We have 7 doctors per 1,000 people, comparing for 4.5 in Armenia, for example. It is more than in Germany, in France, and any other country. And we are the last in this rating if we see the number of nurses per capita, because in situation when government finance your activity, for hospitals it is more profitable to imitate treatment and not to treat. and that's why nurses are less demanded. So we got a very strange healthcare system where there are many hospitals trying to get money from regulations, and that's why I think that we are on wrong way now, and this way is not the way of development. It is the way when we probably got bigger bureaucracy, less efficiency, and less satisfied consumers. For instance, before this coronavirus, which influenced very much situation, the main idea is how to improve healthcare system. It was to implement DRG system. It is a system when government pays not for particular activity but for whole treatment. And many countries had implemented this system, and every country, including United States, has many problems because incentives become worse. Incentives become worse after this system. Regulation becomes more difficult, and efficiency is decreasing. So the idea that we started regulation of healthcare, we tried to make it free for some groups of people. Many countries had the same experience, and we don't know any good example how it was this kind of problem were solved. Countries like Germany or United States and Australia, they maybe have better healthcare system, but they have huge problem caused by this regulation. So my research was about these problems, and for me it is very important to understand risks which we can create if political reasons, political incentives become more important in our life than consumers' preferences and humans' well-being. So, but anyway, at this moment, Georgian healthcare is not bad in general. We have positive tendencies in life expectancy, mortality rate, infant mortality rate. So, but it is the result of the previous period when private property and few regulations helped hospitals become more efficient, and there were competition between them, and they were oriented on consumer. And now, when we all are involved in this discussion about coronavirus, it is also interesting that the whole healthcare system now is managed from government, from health ministry, and it is a bad example how centralized system can be, and our hospitals lost their independence. They are not able to choose different tactics or tactics of treatment. They can't use different rules, and they should be controlled by government. And it is not good situation if we are if we try to find the solution of the problem when we don't know correct solutions. So we saw many mistakes from our government. We saw many regulations which was fun in general and tragic for many people in our country. We saw mistakes from World Health Organization, for example, from many different authorities in different countries. So that's why better healthcare system is system which is more adaptive for problems. and unfortunately, Georgian healthcare system is not this kind of system. And I think that for our neighbors, it is very useful to study Georgian experience, because they have chance to ignore our mistakes and to build better healthcare which is based on private property, and try to control politicians' incentives to bribe voters. It is the worst thing which we can do if we are talking about any industry, but in healthcare it is very important, because when we are talking about health, there are many stereotypes around this, and it is sometimes very difficult to change decisions, previous decisions, and it is better if you are make better decisions, good decisions, efficient decisions, then you are trying to fix previous mistakes. So this was main idea. Unfortunately, I don't have presentation, but I hope you will get my text, and if someone have questions or some ideas, I'll answer you now or later.
Thank you, Alexander.
Thank you so much for your time and for your time management to join us today. So if any of you has questions, please give it to Mr. Alexander as quickly as possible.
I would like to ask one question and just receive this short.
Okay, I have maybe 1-2 minutes. Okay, so.
Okay, is there any positive COVID-19 response made by the government, by your view? We know that there were lots of mistakes, but still.
It is very difficult to evaluate government's decisions, because we really don't know, we don't have full information about this virus yet. We can predict that maybe in several months we will be able to evaluate our previous decisions. But in general, I think that we got more mistakes than better good decisions. Probably there are some restrictions which can be implemented. For example, some masks or some social distance is very important. We know it. So some rules which can help people to keep distance and to be safe. Okay, it's understandable, but it is very difficult to understand why, for example, children are sitting at home now, and while they're not at school, because of everything we perfectly know that children, for example, don't die from this virus. It is not risky for them. It is risky for elder people or people with different disease. So that's why I think that we can improve, our government can improve its politics. So yes, I can find some good decisions, but bad decisions are in majority.
Okay, thank you for your response. Thanks. That's all from my side.
Our sessions are over, and I think it's time to listen to Alexandra Sabo and have her opinion about the topics and presenters, and we start open discussions.
Okay, sorry, I have to leave you. Thank you very much.
Thank you so much. So,
hi again.
Hello.
Just a second. Well, thank you so much for all the presentations. It was very interesting for me to hear all the correlations that were made between the social systems and various social practices in Armenia, Georgia, and Azerbaijan. And definitely we would like to take into account all this in our work within Working Group 5 at the forum. And I think that the project should be maybe continued in order to look more in details at the consequences of the pandemic and how, let's say, the pandemic will trigger social change in the countries. So I think that maybe this is something that potentially both the researchers, the organizers, and the donors in this case maybe could keep in mind, and this could be maybe the continuation of this project. So thank you so much.
Thank you for your opinion, Alexandra. Maybe other participants also wish to share their opinions.
I have a very short comment to share.
Yes, please.
Because I have also the time shortage, maybe I will not be able to participate in the final session on about the future of this expert network. Therefore, I would like to share now some points as how to also this COVID-19 environment give the new the new topic to continue this kind of regional studies and comparative regional studies. And also, I see the two dimension here. In this round, actually, we all have a country cases, a country-based analysis. Maybe in the next round, we will need a regional comparisons. For example, even to compare the amount that the governments pay to the low-income population as a cash assistance, and to compare all these issues. Other comparison of the COVID-19, the related specific health indicators among these three South Caucasus countries. I mean, for example, the capacity of the healthcare systems in terms of number of intensive care units, number of, for example, ventilators, access to the protective equipments by doctors on these kind of issues. And all these indicators in the regional comparison framework or format can be very interesting for the wide range of stakeholders, from the decision maker to the regional and international organizations. Another direction or dimension here is that also when we compare these three South Caucasus countries with other post-Soviet countries, also there are very interesting actually patterns in this framework. For example, we have a high number of cases in Kazakhstan, Azerbaijan, and Russia. All these three countries are very rich, energy countries, energy exporting countries, have a higher rate of savings in national level and strategic foreign exchange reserves, and etc. But we also have a very high number of cases in terms of confirmed COVID-19 cases and the number of days. In that, relatively small in terms of population and territory, and landlocked post-Soviet countries, including Moldova, Armenia, and Kyrgyzstan. In case of Moldova, the number of cases is even higher than Armenia. So it means actually, so there are different patterns of the trajectories of the COVID-19, but also the huge level of financial resource didn't prevent these countries to effectively respond to this pandemic. This kind of new research patterns actually can be studied in the next page as a continuation of this project. These are my just a short proposals. Thank you very much.
Thank you. Anyone else? Then I think it's time to go to the conference conclusion, and thanks to Caucasus Civil Initiatives Center of Georgia for organizing this wonderful and important conference, and for its partner organizations, Public Association for Assistance to Free Economy from Azerbaijan and Association of Social Workers from Armenia. Thank you to experts. Thank you for people responsible of providing and conducting this conference. And today's session is over.
Thank you very much.
Yes, dear participants, I would like to thank you also for finding time and joining us. Hope you received the useful information, and we would be very happy to continue this topic and provide you more detailed information. Thank you.
Very much.
Thank you.
Thank you.
Thank you.